This is going to seem like an unbelievable story to many of you, but unfortunately, it's all too real. A woman whose son benefited from lower premiums under Obamacare is crediting Trumpcare, which doesn't exist, for lowering her son's premiums. 52-year-old Tennessee woman Charla McCormic is very confused. Her son lost his job. His healthcare premiums dropped from $567 a month to $88 a month because of Obamacare. She thinks it was because of the American Health Care Act, which hasn't been made into law and isn't even completely Donald Trump's creation, but she is saying Donald Trump is to thank for her son's decreased premiums. She said at a Trump rally a few days ago in Tennessee, quote, "A blessing from God. I think it was just because of the tax credit." Of course, there is no tax credit for her son for health care because the Republican proposal isn't law. The price drop was not because of a non-existent tax credit, but rather because of an Obamacare subsidy. She said she's also not worried about her disability benefits or her toddler granddaughter's Medicaid because Donald Trump is the president. Of course, you and I know that Trump and the Republicans in the administration want to cut Medicaid and disability benefits and Medicare if they could. Totally ironic and misguided. Tennessee is one of the states where Republicans actually blocked the Medicaid expansion. A quote from Charla McCormic: "So far, everything's been positive from what I can tell. I just hope that more and more people and children get covered under this new healthcare plan." There is no new healthcare plan. Of course, this is a plan that would see, if made into law, 24 million people lose coverage over the next 10 years, according to a Congressional Budget Office estimate. She says she has never trusted a president as much as she trusts Donald Trump. And at the rally, Trump blamed the trouble that the AHA is having in Congress on Democrats and, quote, dishonest attacks. How can you ever reason with someone who credits a non-existent program for the reduction in healthcare costs that are actually to be credited to Barack Obama?
I really just don't understand the lack of curiosity here. If someone in my immediate family had their coverage premiums dropped from $567 a month to $88, I would want to get to the bottom of it. I would want to know why that happened. And for her to just assume that now that Donald Trump's president, he must be the reason why, it just goes to the idea that they just treat him like a saint and that he's just able to accomplish all of these things.
She found the answer that she likes. That's the reality. So why would she be curious to find another explanation? And we've been wondering how the Obamacare replacement would fail but not hurt Republicans. This is an example of how crazy things can happen. This is sort of like explaining to a Republican that abortion rates have fallen for the last 40 years, even though access to abortions has increased. And they'll say, oh, Texas blocked abortion clinics, and that's actually why abortion rates have gone down or something like that. I've said this before, and every time it's controversial. Is there any point, Pat, in trying to convince people like Charla McCormick of anything? Or is it better to say, hey, you know what? These people are a lost cause. And the real way to win future elections is by turning out voters who are reasonable and connected to reality. And if you think about being an activist in a campaign, what would be more effective? How much time would you need to spend to convince someone who's this deluded to vote for someone else versus just getting 5 like-minded people who might not vote to go and cast a ballot?
I think you really should try, because Bernie Sanders has been doing these town halls in states where Trump won.
True.
And he's been willing to convince those supporters to come to his side and actually cheer for progressive ideas, things like universal health care and the rest of it.
You're not wrong, but can you scale that? Can you scale that technique in the same way that working on voter turnout might be scaled? I don't know the answer. And I know every time I mention it, some people email me, they say, David, you're right. Charla McCormick believes that Trump is the solution to every single one of her problems, and she is committed to that. It's not worth wasting time on her. And then others will say, no, it's always worth investing some time.
Just one more thing on this. If the American Health Care Act does actually pass and the subsidy is removed and her son's premiums go back up to $500-600 a month,
who will she blame?
Will she blame Obama?
Probably. Yeah, probably she will. Or Democrats in the House or Senate, who of course have very little power right now. Scary stuff. Today's program made possible in part by ZipRecruiter. If you are hiring, if you've hired in the past, you probably know that posting your job listing in just one place is not enough to find quality candidates. To really find the best hire, you need to post your job everywhere. And now you can with ZipRecruiter. They have 9 million resumes you can search through in their database. You can add multiple people to your account if you have multiple people on the hiring team. But most importantly, you can post the job to over 200 job sites as well as social media networks like Facebook and Twitter with one click. Their website also shows you trending career fields, cities, searches. You can look for candidates in a particular city or within a particular industry anywhere in the country. And because of their screening back-end system, you don't have to juggle emails or calls to your office. You can screen candidates, rate them, and hire the right person quickly. And if you encounter any issues or have questions, there's an actual human support team that you can turn to for help. Right now, David Pakman Show viewers and listeners can post jobs on ZipRecruiter for free by going to ziprecruiter.com/free trial. That is ziprecruiter.com/free trial. One more time to try it free. Go to ziprecruiter.com/free trial.